So that's good to know. Okay, once again, dankjewel, Joran. Thank you very much.
Sure.
We are staying more or less on time. Next one is, and this is also interesting on how the public has responded to this, very practical, transparency and open data in the service of health in Castile and Leon in Spain. And about, let's see, a year ago, Castile and Leon launched a national dashboard to monitor the COVID pandemic. And one of the brains behind that is Antonio Ibáñez Pascual, who's head of transparency and information reuse governing council of Castile and Leon. Antonio, tell us about it.
Thank you very much, Chris. I work in Castile and Leon government. Castile and Leon is a Spanish region with over 2.4 million people. In Spain, regional governments have the competencies in health. The pandemic that has plagued the world for just over a year has caused society, the media, and public officials to demand reliable, abundant, timely, and clear information. Citizenship needs to know what is always happening. The administration had to respond quickly, offering the maximum possible amount of data to be able to make an accurate account of reality. Our priorities were determined by two factors: what we thought would be of value to citizens, and second, what people asked us for. At the beginning of 2020, we had already developed several dashboards, and with the explosion of COVID pandemic, the main challenge was the need to launch in a few days a dashboard, trying to respond to citizenship's demands. As you may guess, we had to face a series of difficulties in this project that showed the scale of the project. Coordination between several ministers and many users, very changing and complex data, daily updating, impossibility of planning, and initial absence of criteria for the extraction of health information. The outbreak of the pandemic surprised everyone without an adequate planning or the necessary dimensioning of services. Quick reaction to the demand of data. We started with 2 datasets, and now we have 34. And finally, the characteristics of our region are also a challenge. It's the 3rd most extensive region in Europe, the largest in Spain, with a population that's all and widely dispersed in small cities and rural areas. Castile and Leon has the largest number of municipalities in all of Spain, more than a quarter of the total in Spain, 2,248, of which 94% have under 2,000 inhabitants. Getting detailed data from this extensive territory increased our challenge. Not to mention that we had to ensure protection of personal data rules are respected by all these government bodies. The solution has a number of features that undoubtedly enhance the user experience and meet the needs of visitors. Reliable information, daily update, clarity, adaptation to needs, responsive, open data, of course, and reusable graphs and maps. So on March, we launched a COVID dashboard to make the information accessible to anyone. We started with a single page with some KPIs, a table, a couple of maps, and 2 graphs. As we added new data sets, we created several navigation tabs, and now we use a drop-down menu. Currently, the portal offers information organized by categories, some of which are only offered in Castile and Leon. I'm not sure if I can launch the video. It's not, I think it's not working. Okay. So the portal has 16 different pages which are accessed via the top menu, and we provide information about risk indicators, vaccinations, basic health zones, situation in hospitals, in teaching centers, in residential centers, and health professionals. So we have been updating daily 20 of these data sets, even on weekends and holidays. And all of them, we keep the history. The datasets accumulated more than 1.6 million records. We publish data with as much detail as possible to offer the clearest view of what is happening, but safeguarding people's privacy. When available, we publish information by gender. We also publish data by health areas, by provinces, or by municipalities. But in small municipalities, we do not offer numerical data. That is, we publish anonymized data that does not allow identifying people on such a sensitive subject. There are hundreds of professionals, health and administration staff, who enter the data into the administration's information systems. Our data providers have been the ministries for health, family and equal opportunities, and education. It's not possible to publish data without the involvement and commitment of other government bodies. They are really the ones who provide the raw data with which we work to communicate on the web portal. In this way, the leadership of the Transparency Senior Officer requesting this information inside our organization made it possible. He has the support of the regional government vice president, who is also the transparency minister. We've done an active listening of the users and media. We provide a contact form, and we also interact in Twitter. We have considered the demands when incorporating new datasets or visualizations into the portal. Indeed, 50% of the datasets have been published in response to their demands. Citizens want to know firsthand the evolution of the pandemic in order to make decisions, often vital. The media has also need access to a significant amount of data that they can use to tell what is happening. Anyone only has to look at the flow of news and journalistic works that have taken place over the last few months to understand the importance of information about this pandemic. Researchers, scientists, and in general, the users also need as much data as possible. This will allow them to exploit it without making hard efforts to obtain it. Finally, the administration itself also needs to be able to exploit the data for evidence-based and motivated decision-making. In this way, it will be able to ensure that it gets it right as far as possible, protecting and saving lives. The number of visits to our portal also shows the impact of the project. More than 4 million users, 23 million sessions, and 43 million page views in 1 year. Never has a public information website in the history of our region and our country had such a level of audience. Researchers have downloaded them more than 1.2 million times to carry out their own analysis and studies. In addition, the media has incorporated our graphics in their digital or printed editions. The response to these such levels of transparency has been excellent. Our level of transparency has been recognized by a lot of media and the highest among all Spanish administrations. Castile and Leon has occupied the first position in the national rankings of transparency about COVID. We managed to publish a lot of information that has not been published in any other administrations. On the other hand, many citizens and researchers email us to publish posts on social media to thank us for the information we publish. Indeed, publishing all this information has allowed there to be few consultations and few demands to open information because we had already been publishing the information that citizens and journalists demanded. This project has already been recognized as good practice with 4 awards to date. All of this has improved Junta de Castile and Leon reputation. In this long process, we have had to face many difficulties that we have been overcoming and that we have become strengths of the experience. We have managed to develop this project without a specific budget. There has been no additional cost. We have used the tools and technology we already had at the beginning of the pandemic. The gravity of the circumstances and the need to undertake this project urgently led us to optimize these tools to the limit. In addition to this, the team dedicated to this task is very small, from 2 to 4 people depending on the moment. We have been optimizing the data preparation and loading processes so that the time spent on this project has not been increased compared to the beginning of the project. The excellent cost-impact ratio makes the project one of the flagship initiatives of our administration. It has managed to enhance its reputation, involving all levels of government. Finally, the change within our organization has also been great. We are developing a data-driven culture, and we will continue promoting two things: creating more visualizations. These visualizations allow citizens to better understand what our government are doing, transparency, and the existence of datasets. And second, internal reuse. Professionals will use the information from visualizations to make decisions and will understand better the benefits of publishing open data. The COVID crisis has served to make visible the power of data. We must take advantage of it. Thank you very much.
Muchas gracias, Antonio. I have a question here, and in fact, I have one from myself, actually. I'm very interested and curious. As you're being taken up by the public, I mean, amazing, 43 million views, more than that, 4 million users, that the media turns on to it, they're using that. How do you deal with disinformation? How do you quickly react to that? Have there been cases where you saw there was disinformation out there and you sought some way to provide information to dispel that or to counter it?
Well, this is a very complex task, because to publish the information, it needs the involvement and commitment of other governing bodies. The data, before being published, goes through different phases until it reaches the final result and is published on the dashboard. Professionals enter the data into the administration information systems. The ministries for health, family, and education validate this data. Then we analyze the information extracted from the available information systems and respond to the demand of information. The staff of our directorate centralize the information. We prepare the data sets, and finally we publish them after checking that the information is correct, and we spread that the information has been published in Twitter.
Yeah.
So there are so many steps.
I mean, there is a process there. There's a step-by-step process.
And we have to respond very quickly. So we have to be very focused on. We have been focused on this project. This is a very quick response, and we have worked very well with other ministries, because in another way it wouldn't have been possible.
Mm-hmm. Okay, I got another question for you. How was this data integrated at a national level? Are there other similar regional dashboards and/or a national one in Spain?
Okay, this is a very good question. First of all, I must say that in Spain, the competencies in health are for the regional governments. So the national government hasn't been collecting a lot of data of all the regional governments. They have been collecting a very specific information, and that we send from our regional government. But most of the information we have been publishing in our open data portal is not being publishing by other administration, and of course neither in the national open data portal.
Great. Okay, Antonio, thank you so much. We're on time. It was very enlightening, and best of